on the clerk's desk?
Correct, Mr. President.
There was a motion and a second to suspend the rules. All those in favor of suspending the rules, vote aye. Already called for the vote. All those in favor, I heard 3 ayes. Those opposed to suspending the rules, vote no. Senator from Jefferson 19.
Would it be in order to request a roll call vote?
Motion been made. There was no request for a roll call when the chair sought for a vote. Delayed, went very methodical, looked, no one asked. Therefore, Senator from Scott.
Thank you, Mr. President. Please ask the clerk to report House Committee Substitute Number 1 to Senate Bill 150.
Mr. Clerk, would you please report House Committee Substitute Number 1
House
to
Committee
Senate Bill
Sub
150.
House Committee Sub 1 to Senate Bill 150.
Senator from Scott.
I move that we concur.
The matter for the body is concurrence to House Committee Substitute Number 1. All those in favor of concurrence, say aye. Aye. Opposed? Ayes have it. House Committee Substitute Number 1 is concurred with by this body. Senator from Scott.
Thank you, Mr. President. What we have back from the House is Senate Bill 150, which has been voted on twice already in this body in various forms, sponsored by the senator from Taylor. It deals with the rights in public schools to ensure parent communication, inspection, and authorization regarding a variety of health services and curriculum on the subject of human sexuality. It also adds language relating to student privacy rights. It also contains new language that is modeled after a law in South Dakota that prohibits a healthcare provider from knowingly providing services to a minor for the purpose of attempting to alter the appearance or perception of the minor's sex. These services include prescribing or administering any drug to delay or stop normal puberty, prescribing or administering testosterone, estrogen, or progesterone in amounts greater than would normally be produced internally in a healthy person of the same age and sex, performing any sterilizing surgery, performing any surgery that artificially constructs tissue relating to the minor's genitalia. Also, it creates exceptions for these services under certain conditions. It established penalties for healthcare providers who violate the prohibitions, which include revocation of their licensure or certification to their respective professional license. It establishes a right of action for personal injury up to age 30 for minors who receive the services that are inconsistent with the minor's gender. It also provides for the continued treatment of a minor if a healthcare provider determines that immediately terminating a minor's treatment or administration of drugs or hormones otherwise prohibited would cause harm, but allows the healthcare provider to institute a period of time during which the minor's use of the drug or hormone is systematically reduced. And Mr. President, therefore, with that explanation, I move for final passage of Senate Bill 150 as amended in the House and concurred with in the Senate.
The matter for the body is final passage of Senate Bill 150 as amended and concurred with on House Committee Substitute Number 1 by the Senate. Seeing no one seeking recognition, Madam Clerk, please call the roll.
Senator Berg.
Senator from Jefferson 26, please cast your vote and explain, limited to 3 minutes.
Explain my no vote, sir.
Please proceed.
I was hoping to be able to vote aye to a reasonable amendment that would have made this a much more reasonable bill. 470, as it was originally presented to us from the House, was viewed as the single worst anti-LGBTQ legislation that has come out of a state house in this country this session. I want the people in Kentucky to understand that your elected legislators have spent hours and hours and hours. Because when you give them the truth, when they start understanding the story, the ones that aren't so politically motivated that they actually still care about people can't vote for this. They know it's not the science. They have met families. They have met somebody from their own party. Believe it or not, meeting a Republican with a grandchild meant more to them than every piece of medical literature I could give to them. Every national society that is reputable. All the medical guidelines that we follow in this state. Our own licensed, certified, boarded physicians coming to speak to you. Every one of them leaving their patients, taking their time, calling you, begging you to listen to the science. And guys, it's not like you haven't had time to learn. My child came up here 10 years ago. You had time to understand the science. You had time to get yourself educated on this subject. This is absolute, willful, intentional hate. Hate for a small group of people that are the weakest and the most vulnerable among us. You need to come back to these people and you need to ask them, why did you get elected? What are you doing here? What was your purpose in choosing to serve? Because if it was to help the least among us, you are failing miserably.
Senator from Jefferson 26.
How much longer do I have, sir?
You have used your 3 minutes per the rule.
Thank you. I vote no.
Senator Boswell. Aye. Senator Carpenter. Senator Carroll.
Senator from Marshall, please cast your vote, then explain. Limited to 3 minutes.
Mr. President, I'd like to cast a no vote and explain my vote.
Please proceed.